We have an athlete on the table today that we Rocktape about 3 days ago. She came in with a twisted ankle. It was pretty swollen, about twice its size, hard to walk on, very painful. She's had the tape on about 3 days now. We're going to kind of take it off, see how she's doing, see if we need to reapply. We did our basic ankle protocol with shearing band, laser, Rocktape. Looks pretty good. Swelling's down, pain level's down, as she stated. Much better. Much better. Our goal is to get her back on the court as fast as we can, get her back playing basketball, and have zero pain. Alright, so now the first thing we're going to do with this ankle is we're going to use what's called a shearing band. This one's made by Rocktape. Got a lot of good stretch in it. We just picked these up down at Dallas when we were down at a conference. Very good product. We're going to apply it very tight. You always want to wrap about half of the band over top of itself. One thing that's important to remember with these bands is you want them as tight as you can get them without causing too much pain to the athlete. And you only want to keep it on there, I always keep it on about 3 minutes, because you don't want to cut off circulation. But you do want it tight. You want to be able to push out some of that inflammation. So this is what it looks like after we're done with the band. I do a simple heel lock down at the bottom, nice and tight all the way up. I always like to do a couple stretches on my own, ask the athlete how it does, how it's feeling, make sure she can move it okay in it, and then we'll go through a series of exercises and protocol in the office to make sure that this is healing quickly and as fast so we can get her back on the court. Make sure you walk as normal as possible. Heel to toe, pushing off on the toes. Okay. Good. Go ahead and hold on for stability. Good. Excellent. How's that feel? What I want you to do here is I want you to concentrate on pushing your toes into the ball. Good. And try to hold. When you get tired or you start to burn, let up a little bit with your toes, relax. All right, Alex, we've had it on about 3 minutes. Let's go over here to the bench, take it off, so we get some blood flowing back in there, and we'll take a look and see what it feels like. Good. So now we're getting it off, getting the band all the way off. You'll see you got some stripes. It'll turn red. I always like to have the athlete, after we take the band off, walk a little bit to get some of the blood flow back into the area, and just to make sure that it feels okay. Yep, Alex, take a walk down the hall for me. As you can see, she's toeing off real well. She's walking with pretty much no pain at this point. Excellent. So this is my portable laser. I like this laser because I can stick it in my pocket when I'm at practices or I'm moving around in the community. I can always have it with me, but we use it a lot in the office. Most of her pain is just on the top here of her foot and just below her medial malleolus here on the inside of her foot. Typically, most pain from a twisted ankle will be down here in the Y ligament, under the fibular head, but that's not always the case. Hers isn't a whole lot down there. I still like to hit that because there's a little bit of swelling and bruising, but that's not where her pain is. So we're going to focus up here on the top of her foot and just here under her medial malleolus. All right. So we just got done lasering the ankle. This is a class 3 cold laser with an E-stim in the head. So research has shown it to be 93% effective on pain relief. It also helps with swelling. we use it on all kinds of injuries, extremities, joints, ligament, muscle tears, all kinds of things. It's proven to be a workhorse in our office, and we use it most of the day on almost every patient. So if you don't have one of these, this is a great thing to pick up. So this is Rocktape. HealthSource and Rocktape have a great relationship. Docs from HealthSource go become certified rock docs, where we learn how to apply all the new techniques and what we should do for an injury. They also label our tape with HealthSource, so we get a little bit of advertising out of it. Alex has chosen to wear the pink Rocktape today, so we're going to tape this ankle in the normal ankle protocol to help stabilize it a little bit. Rocktape is very, very good at what they do. On the back of the tape, there's groove channels. I don't know if you can see that or not. There's grooves in there. Those grooves help pick up the skin and fascial layer there off the muscle, and that's where all the fluid lies. And if we can pick that up and make those channels bigger, we can flush fluid out quicker and it'll heal faster. So now we're going to apply this the way we want it. All right, Alex, toes up for me. Point your foot just like that. Perfect. We're going to do a wrap. Nice wrap around the foot, right across the fibula, under the foot, through the malleolus where she has her swelling. And then we're going to come up the side of the foot, side of the calf, just a little bit there. There we go. All right, so now we're using a Rocktape band, and I just want to show you a couple things you can do at home to help stretch out this area, help maybe work a little bit at home when you're not able to come in here, okay? So you've already got one of these Rocktape bands at home. I want you to stretch that for me and pull up on the reins, stretch out that your Achilles a little bit, and just kind of try to relax your foot. Let that kind of pull up a little bit tighter. Good. And then after you get it up there a while, I just want you to push down like you're pushing an accelerator of a car. Good. And then back. Good. And then after you do about 10 of these, I want you to act like you're writing the ABCs with your foot. So A, B, come around, C, big swoop in circles, D, swoop circle the other way, perfect. And that's just going to get some good mobility in that ankle, okay?